give us an update, please.
Awesome, thank you. Unfortunately, Colorado has taken a bit of an uptick. There have been a surge in cases, as you've been reading about in the United States in general, and Colorado is no exception. So you can see our uptick here, and again, nowhere close to where we were, over the winter holidays, but certainly much higher than we were at any point prior to that point. So it is important to remember that we are, not out of the woods yet. Our positivity rate in Colorado is also increasing. So the red line here tells us that the rates in Colorado are increasing along with the cases, which of course makes mathematical sense. Unfortunately, Lake County is no longer lightly colored. We have had our surge here as well. And we are now in the very high range again, and as there are lots of populous counties in Colorado. Hospitalizations are unfortunately following the trend where there are more cases, there are more people who are sick, and there are more people that need to be hospitalized. Deaths are leveled out. The hope with all of the vaccination effort is that the folks who are most vulnerable have been vaccinated, and so that we won't have those folks get sick and unfortunately pass away. It's a hope. We really, we're kind of learning along the way here. The good news is that the governor announced that most people now over 65 have gotten their 2 vaccines. And so the most vulnerable of us are protected. Our data, not great. You can see our surge here too. We have had multiple cases over the past week. And that little thing I like to brag about these little 0 dots here, we've had none of those over the past 10 days. So our numbers are increasing as the rest of Colorado is. Our positivity rate looks similar. Our slope is steep, so we have lots of folks comparatively, to what we enjoyed here over the earlier parts of the spring, who are coming in, who are positive. Hospitalizations, we're seeing an increase there. This is last week's data. We do have a hospitalization today for someone who is COVID positive, so our hospital data continues to mirror Colorado as well. And if you look at our rate of positive cases, we've had 23 over the past 2 weeks, which brings our positivity rate up over 14%. So it's a lot, comparatively to, where we were. The good news, our vaccine effort continues to blast forward. 38% of our goal, and remember, if we can get to 70% of our goal, that's what we're looking for herd immunity. So we're definitely getting there, which is awesome. And if we can just get more shots in arms, we'll be able to blunt what's happening, which is obviously what we'd like to do. So if you have not gotten your vaccination, the governor did open it up a week 10 days ago for anybody. And so anybody over 18 is eligible for a vaccine in Colorado. And the president actually next week will make the announcement that anybody who wants a vaccine that is over 16 in the United States should be offered a vaccine. So don't be shy. Come on up. There are 4 vaccination points for the 18 and up group, Rocky Mountain Family Practice, St. Vincent Health, and then the Public Health Department. The Public Health Department today has a mass vaccination planned for the college. They during their last vaccination, mass vaccination last week, they did well over 400 vaccinations in a 6-hour period. So that was fantastic. 8-hour period, sorry. And they hope to do the same thing today. There are still spots available. So please do log on to the Lake County Department of Public Health website. I don't know, Josh, if you can put that into the chat, but how to log in to get your vaccination, that'd be great. St. Vincent Health is still accepting appointments, as am I at Rocky Mountain Family Practice. All you need to do is call our offices and we will put you on the list. Right now at Rocky Mountain Family Practice, we are booking 7 days in advance, so there's still lots of availability. Safeway is also offering the Pfizer vaccine. And remember, that's for the 16+ crowd. So if you have a slightly younger teenager, you can do the Pfizer vaccine. You go to the Safeway website, click on the COVID link, and the appointments open up either very late in the evening on Sunday or very first thing in the morning on Monday morning. Because it's a a national chain, Safeway usually books up quite quickly. They do 86 vaccines a week, so there aren't a ton of spots. And so certainly, if you have a teenager who can't get a vaccine, anywhere else because they're only 16 or 17, please log on to that site quickly. Again, late Sunday night, early Monday morning, and get your teenager set up for their vaccination. And then again, there's that. It's a lot of information, obviously really pushing to get these vaccines done for folks so that we can not have to worry about any surges or things like that. Are there questions for me about that?
Lisa, I have one question. This is Amy. The 38% for Lake County vaccinated, is that one dose or two?
That's a combination. Unfortunately, it's difficult for us to be able to figure out, the actual math of that. But what I did is, you can see the goal is 12,000. So there are 6,000 people that we estimate in Lake County that are eligible for a vaccine, so who are 16 and older. And so that's where I got the 12,000. So it's, almost 40% of a 2-shot regime. And so, if we can get, like I said, up to that 70% mark, that accounts for the 2-dose vaccination. We don't have the J&J vaccine here. They're being used in larger communities where there are more homeless or incarcerated folks who will likely not come back for a second vaccination. When there are extras, they do offer it out to the public at large. So for example, in Chaffee County, you can get a J&J vaccine because they have such a large prison population there that they're using them to vaccinate the prisons. And then when they are done, they then give that shipment to the or what's ever left over to the Department of Public Health there, so that you can get the J&J vaccine. So that's also gonna screw up our math, but obviously it's not about the math. It's about getting shots in arms, and we're clearly doing a great job making that happen. But we've seen a slowdown in folks who are interested in getting their vaccination. So people who just walk into my office, you get a shot. You're there for a blood pressure medication refill, you still get a vaccination. And it's just trying to get those people to come in. Is what I'm a little concerned about now. That the interest in getting vaccination is not as vigorous as it was a couple weeks ago.
Dr. Lisa, this is Pat Clover. I don't have the advantage of looking at your screen. What color code is Leadville in Lake County at this point?
Yeah, so if you're talking about the dial, we're gonna yeah, it's a loaded question, ma'am. So right now we're fine, but Colleen is gonna have a conversation with the Colorado Department of Public Health today to determine if we need to change our dial. The significant increase in numbers happened in a very isolated group of people that had no contact with the Leadville populace at large. So the infections were very, very well contained, and no one else in our community was exposed. So we're going to make the argument that although our numbers are up, that this particular outbreak was not one that involved the Lake County Leadville populace at large, and so our dials shouldn't change. We'll see how that goes.
Lisa, this is Greg. I understand that as of a week from Friday, the dial is going to cease to exist in Colorado. They're no longer going to use the dial. Is that your understanding?
That's my understanding as well, sir. Yes, and the big push is vaccination. right? So, you know, we just have to get shots in arms. And if we can do that, we have no more surges. And so I think that all of the energy that's, you know, put into reprimanding folks about, you know, how, you know, how not, you know, not wearing your mask, you know, hopefully is replaced with, oh, good, you got your shot, which, you know, will change the way that obviously we deal with this pandemic.
I would also say that, I mean, this is just an opinion. I've had the same conversation with Colleen, that at this point, it doesn't seem to me to be very important, the surges. I mean, and by that, I mean, our older population over 60 have been vaccinated by and large. We have a very young population who, no matter what we do, they're going to expose each other. There's no way to get around it. But it seems to me that it could be a good thing for the virus to work its way through the younger population where even if they get sick, it's not dangerous for them.
So you can tell that to my 17-year-old hospitalized patient who has COVID right now in my hospital. You know, and with all, you know, with all due respect, sir, it's not the case. You know, the chickenpox parties, right, that we had when we were kids, right? So everybody goes and sleeps with the kid in the block who has chickenpox because all the parents wanted us to get chickenpox. You know, that is not what happens here. And there are people who are young, who are still very susceptible to complications with COVID. And so natural immunity amongst our youth is not a goal. And you're right. You know, I have two teenagers. They're very responsible. They like to, you know, swap various body fluids, and are, you know, they're getting each other sick, which is, you know, not optimal. So even though the most vulnerable, and I certainly agree that, you know, the 65 plus crowd are very well vaccinated, and those were the majority of the deaths that we saw early on, our kids are still getting sick. And it's still not a good idea for them to try and get a natural wild type infection. We still need to protect ourselves.
Okay, thank you.
Yes, sir.
Any other questions for Dr. Lisa? Lisa, thank you again for the update. And sorry that we don't have as good a news as you'd like, as we would like, actually.
Yeah, just get people in to get their vaccinations. You know, it's all up to us, right? Who are community leaders, people who are out there, you know, talking to our roommates and our families and our friends, and you know, helping them get the shot in the arm. So I just encourage everyone that that's really, really where we need to go right now.
Very good. Thank you.
All right. Yes. Thank you, everyone. Have a great day.
Hey,
All right,
hey, Bob,
Yes.
just a quick note on to tag along with that. So I just emailed Jane. It looks like the link to expire for today's vaccination clinic at CMC is no longer active. Jane says they might have a couple spots left. So I'll put a link to an email address in the chat. If people know anyone who wanted to get in today and weren't able to sign up, they can email this link and see if there's a way to get in today.
Okay, very good. Thank you, Amy.